Okay, let's discuss next the language of anatomy. We can talk about special terminology used to prevent misunderstanding. We can get exact terms to use for position, direction, regions, and structures. We even want to have an anatomical body position that is standard, where we always think of our patient in this position, standing up with their body erect, feet slightly apart, palms facing forward with their arms down at their side, and their thumbs pointed away from the body. You also want to keep in mind with a patient, you want to use their left and their right, not your left or right. So use the patient's left or right, which is opposite your left and right. When we use regional terms, we use them to designate specific areas within body divisions. There are two major divisions of the body: the axial, which includes the head, neck, and trunk, and the appendicular, which includes the limbs, the legs, and the arms. And the appendicular part of the body is attached to the axial part of the body. Next, we're going to be looking at planes of section, which include three main types: the sagittal, frontal, and transverse plane. The sagittal or median plane usually is right down the midline and separates the human body into equal left and right halves. Now, you can have a parasagittal plane that's not separating the human body into equal left and right halves, but instead is separating it into unequal left and right halves. A frontal plane separates the human body into an anterior and posterior, or front and back. And a transverse or horizontal plane separates the human body into a top or superior and bottom or inferior part. Now, what we're seeing here are imaginary planes of section, but they do represent real sectioning that can occur during autopsy or digitally using something like an MRI or CT scan. So body planes go along surfaces, and they're representing areas that might be cut for anatomical study. We've talked about the three most common planes, but there are others like an oblique section, which is a diagonal section of the body. So make sure that you review the three types of planes, such as a sagittal section, and what median versus parasagittal means, a frontal section, and how it separates the body into anterior and posterior parts, and that a transverse section is also known as a cross section or horizontal section, and separates the body into a top and bottom. This is a great study slide to come back to in order to look at all of the body planes and sections. A sagittal plane again can be mid-sagittal or parasagittal. A mid-sagittal plane cuts along the midline of the body, separating the body into equal left and right halves, whereas a parasagittal plane separates the body into unequal left and right halves. A transverse or horizontal plane produces a cross section and separates the human body into a top superior and bottom inferior half. And an oblique section results of cuts at angles that are other than 90 degrees to the vertical plane. So again, make sure you review those, but let's try some practice questions. All right, first question. You are a surgeon and planning to do open heart surgery. You would need to make a blank cut into the chest cavity. If your answer was sagittal, you're correct. What about the second question? You have a patient that has gangrene in the lower portion of their leg and you need to amputate. You would make a blank cut through the leg. If you said transverse, you're correct. And last question, the abdominal muscles and muscles of the back are separated by the blank plane. If you said frontal, you're correct. So here are the answers to those questions: sagittal, transverse, and frontal. All right, next we're going to be looking at the regional terms used to designate specific body areas. So let's start on the left. We're going to look at everything on the head. The head region is considered cranial or cephalic. Frontal is your forehead, and frontal and forehead both start with F. Your orbital region is where your eye is, because your eye sits in an orbit. Nasal is your nose, that one's not bad. Oral is your mouth, again, pretty easy to remember. And mental is your chin. The best way I have to remember this is imagine someone thinking and tapping or putting their hand on their chin. So mental, chin. The whole neck region is cervical, not just the front, but also the back of the neck. So we can actually go over to the image on the right and finish up with the head. So your ear is otic, and the back of your head, kind of where you feel that bump, so just below that, is the occipital part of the head. All right, we're going to go now down the back. The back is considered the dorsal region of the body. It consists of that chicken wing part of your body where the scapular bone is, and that region is the scapular. Vertebral goes down your spinal column. Lumbar is the lower part of your spinal column, just lateral or to the side of your vertebral area. Sacral is just under that. Gluteal is your butt, and perineal is between the anus and the external genitalia. All right, now we got that right side done. Let's go all the way back to the left side. The thoracic region is what we're seeing in orange. Inside of that region, you have your sternum. That's where your breastbone would be. That is the sternal area. Axillary is your armpits. So you have two axillary regions. And mammary is where the mammary glands and breasts would be in females. And the pectoral muscles are in females and males. All right, let's move down to abdominal. That is going to be that upper purple region. In this region, we have the umbilical region, where your belly button is. The pelvic region is just below that, the lower purple region. Below that, we're looking at the pubic region. Within that, or next to it, I should say, is the inguinal or groin region, which is more of that kind of indent between your lower limb, your leg, and your trunk. All right, so we have almost all of it done. We have to go down now the long middle. All right, so when you talk about the appendicular part of the body, we can't really just say arm, leg, because those terms mean something different in anatomy and physiology. So to talk about the whole upper limb, we really just have to say that. We have to say upper limb, where the shoulder is acromial, the upper part of the arm, where it's between the shoulder and the elbow, that's brachial. So if you say arm, you're talking about just that region, the brachial region. The bend in your elbow is antecubital. The point of your elbow on the opposite side, kind of the hard bone, that is olecranal. Your forearm is between your elbow and your wrist, also known as antebrachial, because ante means before, and so it's before the brachial region. Your wrist is the carpal region. The bones in your wrist are also called carpals. And that brings us to the hand. Your hand is known as the manus. Your thumb is pollex. The palm bones are metacarpals, but we actually label the back of the hand the metacarpal region, and the palm part of the hand the palmar region. And both your fingers and your toes are digital regions. So only your thumb and your big toe have different names. Your lower limb is coxal for your hip, femoral for your thigh, patellar for your knee in the front, popliteal for your knee in the back, then crural, sural for leg and calf. C comes before S, and crural and sural are going to be in the bottom part of the body. Crural is your shin, also considered your leg. Sural is the back of the bottom part of your limb. And then fibular peroneal is on the side. And then last but not least, we have pedal, or the foot. That is tarsal, which is your ankle. Also, the tarsal bones are there. Calcaneal for the back of your foot, your heel specifically. Metatarsal is the top of your foot. Digital is your toes. Plantar is the bottom of your foot. And hallux is your big toe. So please come back to this slide, spend time with this slide, practice these terms. If you want to find an image to label, there's plenty online, so make sure you practice this. All right, next we're going to be looking at directional terms, so make sure to come back and go through those.